This is a quick video about burns and what you need to know for the NCLEX. The first important concept for burns is the rule of nines. That's explained in this diagram here. You can see the body is broken up into sections, and this is how you determine the total body surface area, TBSA, of a burn. You can remember it easily because it's broken up into percentages of nines. So we'll start with the legs and move up. You get 9% for each side of each leg. You get 9% for each arm. For the front and back of the abdomen, you get 18%. So 9 for the chest area, 9 for the abdomen area, front and back. You get 9% for the head, and then you just get 1% for the genitalia. This is how you determine the total body surface area of a burn. It's slightly different in pediatrics, but you can follow the same general rule. The next thing you need to know about is about burn management. What do you do when you have a burn patient? First things first, your priority will be to stop the burning process. If there are active flames, stop, drop, and roll is of course the go-to, but this is also in regards to chemical or electric burns. So a cool cloth for an electric burn. For a chemical burn, removing all of the chemical, be that if it's in their eyes, doing an eye wash, or rinsing the area with normal saline, copious amounts of normal saline to remove the chemical. Then you're going to want to cool the burn wound once you've stopped the burning process. This provides some pain relief and stops the tissue injury that's occurring with a burn. You should do this for at least 10 minutes and up to an hour, but don't let the patient become hypothermic. Also, you will be wanting to give oxygen. There is a decreased amount of oxygen in the tissues after burn, and we want to give them that supplemental oxygen to help the healing process. If there's an altered level of conscious, this is especially important. After stopping the burning process and cooling the burn, you will want to proceed with the A, B, C, D, E, F priorities. Airway control, breathing and ventilation, and circulation are always your top 3 priorities. If the patient does not have an airway, get a definitive airway. If you need to bag them, fluid resuscitation, pressors, any of those things come first. Next is disability. Get them trauma naked, take all of their clothes off, remove any jewelry. Metal can still be hot and continuing the burning process, so you will want to remove that from your patient and assess any disability, exposure, and then fluid resuscitation. Fluid resuscitation is a key part of burn management. You need to know the percentage of total body surface area burn and what degree of burn occurred. Is it first, second, third, or fourth degree? As well as the type, if it was heat, chemical, electrical, etc. Keep the patient clean, sedated, and with proper pain management, and move on to fluid resuscitation. The last key with burns is fluid resuscitation. It's vital to provide copious amounts of IV fluids to any child with a burn greater than 10% TBSA and adults with a burn greater than 15% TBSA. Hospital protocol will dictate how much and of what type of fluid you use, but most commonly it's lactated ringers. IV fluid resuscitation is so important, not just because of perfusion to end organs, but perfusions to peripheral tissues. With that damaged skin, we're going to have a lot of third spacing and leaking of fluid, not just into the capillary space, but also out of the body. When we lose that much fluid, our end organ perfusion will be decreased and it'll be very hard for the tissues to heal. So fluid resuscitation is a very important part of the management of burns.